Hello class, my name is Simon Abraham. My celebrity wellness evaluation is on Cristiano Ronaldo, also known as CR7. Background and demographics. CR7 is a popular soccer player of Portuguese origin who currently plays for Italian professional football club Juventus FC as a forward player. Previously, he played for well-known clubs such as Real Madrid and Manchester United. He is a well-known European soccer player, philanthropist, and underwear model. CR7 is a 34-year-old Caucasian male who presents to the clinic complaining of heart palpitations that began 4 hours ago during soccer practice. Symptoms occurred for about 7 minutes and he rates them as mild in severity. Patient reports that symptoms are located in the middle of the chest and describes them as flopping sensations in the chest. Per patient, he had associated exercise intolerance but denies dizziness, chest pain, shortness of breath, nausea, and vomiting. Symptoms are improved with resting and exacerbated by exercise. Patient reports history of similar symptoms at the age of 15. Pertinent medical history includes racing heart diagnosed at the age of 15. Viral signs are described as blood pressure 105/66, right arm sitting, temperature 98.1, oral, heart rate 107, height 6 feet 1 inch, weight 83.5 kilogram, BMI 24.3, pain rated as 3 out of 10, oxygen saturation at 99 on room air. Past medical history of CR7 are palpitations at the age of 15, which is current and active, anxiety disorder, current and active, diagnosed in 2016 when his country lost in FIFA World Cup. He also had ankle sprain, which has resolved in 2015, and anterior cruciate ligament or ACL tear in 2016, which is also inactive. Past surgical history include fascial lift surgery in 2018 to improve his appearance. He's got also anterior cruciate ligament tear repair in 2016 due to sport-related injuries. The patient's medication history includes ibuprofen 200 mg as needed every 6 hours to decrease inflammation of muscles and joint soreness after games. The patient has no known drug or food allergies. Social history. Patient is single. He has 4 children via surrogate mothers. He is a heterosexual, sexually active, and lives with his girlfriend of 8 months. He denies tobacco use. He denies illicit drug use. Reports of occasional drinking during off-season or after a game. He is underwear model, professional soccer player, and well-known celebrity around the world. Patient drinks coffee and energy drinks frequently. His primary language is Portuguese. He also speaks English and Spanish fluently. His religion is Catholic Christianity. Patient family history. His mother had a history of breast cancer. She is currently 64-year-old and still alive. His father died at the age of 51 of unknown cause in 2015. His sister is alive and in good health. Immunizations. He is up to date on all childhood immunizations. His last flu shot was in 2018. Gender-related health. Patient states he performs occasional skin and oral self-exam to check for skin cancer, as he stays outdoors most of the time during games and practice. He also reports he does monthly testicular self-exam after a shower for cancerous changes. He reports of regular tests to check testosterone levels with his primary doctor. He also reports of endurance, fatigue, sprint, and yo-yo tests at his soccer club as part of his practice. Physical examination. His mental status. He's alert, answers questions appropriately and directly, follows commands, and age-appropriate appearance. General appearance. He's cooperative, has no difficulty getting in and out of a chair or on and off exam table, not in acute distress, well nourished and well developed. Integumentary, dry, cool skin, no rash, and no suspicious lesions on skin surface. Surgical scar noted on his right knee. HEANT. Head is normocephalic, atraumatic with no lesion or palpable masses. Thyroid gland is normal and consistent. Otoscopic exam reveals normal external auditory canals with tympanic membranes clear and intact. Normal pinnae with no scars or masses or lesions, and hard and soft palates. Tongue is normal. Tonsils and posterior pharynx are moist, symmetric without lesions. Thick saliva, dry and sticky mouth and lips noted. Chest and lung exam. On auscultation, normal breath sounds, no adventitious sounds, and normal vocal resonance, quiet, even, and easy respiratory effort with no use of accessory muscles and no shortness of breath. Cardiovascular. Normal pedal pulses bilaterally, regular heart rate, S1, S2, no murmur. Sinus tachycardia at 107 beats per minute. Normal P wave, no axis deviation, no ST or T wave change on EKG. Abdomen. Normal bowel sounds in all quadrants, soft, non-tender, non-distended, no organomegaly, no hernia, no hepatosplenomegaly, and no palpable abdominal masses. Neurological. Able to name objects and repeat phrases, able to remember short and long-term memory, no obvious weakness or deficit noted. Neuropsychiatric. Anxious and erratic at times, but able to articulate well with normal speech, language rate, volume, coherence, demonstrates appropriate judgment and insight and attention span, and ability to concentrate are normal. Musculoskeletal. Normal gait in station, no signs of acute joint inflammation, mild muscle tenderness, normal range of motion of all upper and lower extremities. Genitourinary, concentrated and dark urine color, decreased urine frequency. Patient is diagnosed with sinus tachycardia. Differential diagnosis are electrolyte imbalance, fatigue, and hyperthyroidism. Patient is diagnosed with anxiety. He had a history of anxiety. Patient is diagnosed with dehydration. Pharmacological treatment. Patients started on metoprolol 50 mg daily to block the effects of adrenaline on the sinus node and decrease exaggerated response of the heart to the adrenaline. Patient is instructed to call his health provider if he feels slow heart sounds or beats, lightheadedness, shortness of breath, and cold feeling in both hands and feet. The price of metoprolol is $24.40 for 30 tablets without insurance. A patient has also started on Xanax, 0.25 mg orally, once daily if needed to decrease anxiety disorders, panic disorders, and anxiety. Patient is instructed to avoid operating a vehicle while on this medicine. And patient is instructed to call his primary provider if he feels narrow angle glaucoma or worsening anxiety and pounding heartbeats. The price of Xanax is $361 for 100 tablets. A patient was taking ibuprofen 200 mg PRN every 6 hours to decrease inflammation of muscles and joint soreness and to reduce pain and inflammation. A patient is continued on this medication, but he was instructed to stop taking it if he feels changes in vision, shortness of breath, swelling, and signs of stomach bleeding. The price of ibuprofen is $6.99 for 100 tablets. Non-pharmacological treatment. Patient instructed to try vagal maneuvers to interrupt a fast heartbeat and slow it down. He is instructed to practice bearing down and deep breath exercise while holding his breath. Patient is also instructed to practice warm, relaxing bath or shower. Sometimes it can help slowing down the heart. Patient is instructed to increase his fluid intake and drink plenty of water, plenty of fluids until his urine color changes. Also, patient also is recommended to practice yoga and other relaxation methods to decrease his anxiety. Anticipatory guidance, private intervention. Patient instructed to increase his fluid intake and drink plenty of water before and after exercise. Patient is instructed to do flu vaccination every year. Patient is instructed to avoid or minimize drinking coffee or energy drinks. Secondary prevention methods. Patient is instructed to continue testicular self-exam. He is also instructed to learn how to check his vital signs, including heart rate, at home. He is also recommended to stay off soccer-related activities until his signs and symptoms improve. He is also recommended to get plenty of rest and sleep. His follow-ups include to follow up with primary care in about 7 days to recheck his blood pressure and see the effectiveness of his medication. In the future, there's a consideration for a referral with a cardiologist if his heart rate doesn't decrease or no signs of change are observed. He is also instructed to call the clinic for any questions or concerns not discussed in this visit.